Hi everyone, Addie here, back with another Ask the Provider question. Kind of the first thing to think about overall is just a patient's exposure. Is the person inside all the time? A lot of blue light, not getting enough of UVB light on a regular basis. Latitudes, like more northern latitudes, tend to have more of a vitamin D deficiency. There's a dietary intake component. We need to have more fatty foods like fish, eggs, things like that are helpful, but usually not enough. So another question to ask is there been like a restrictive diet intake? And this goes into the next segue of absorption. Vitamin D is a fat-soluble vitamin. So if there's an underlying GI issue, let's say Crohn's or colitis, or there's been a history of bariatric surgery, for example, those underlying conditions can exacerbate the malabsorption, so that also can drive vitamin D to be lower. And then we have to talk about conversion too. Vitamin D liver, the conversion happens in the liver, and then activation of the vitamin D happens in the kidneys. So if there is, again, an underlying issue with liver, hepatic, or kidney concerns, that could be driving some of the vitamin D issues as well. Adipose tissue, vitamin D tends to be sequestered or basically trapped in adipose tissue. So if there's underlying issues of obesity or a patient being overweight, that can contribute to the problem as well. Other medications can absorb it. The biggest one right off the bat would be steroids. So has there been a history of previous steroid use? Cofactors, vitamin D is dependent on magnesium. So is there a magnesium deficiency that's undiagnosed or not being addressed? And then there's also genetic conversion issues. So those are the big ones for vitamin D deficiencies.